we need to help the human, the body, to actually better heal when we come in with a regenerative injection therapy. So one of the things that we found here through working with our patients is that when there's an underlying systemic condition that impacts the body's ability to heal. So we think about things like hypothyroidism or low hormones, whether that is low estrogen, low testosterone, low growth hormone or IGF-1, or when we have some inflammatory conditions that, again, are still going to make it a little bit harder to heal, whether that's an age-related inflammatory increase that we see, likely from the SASP or the secretory proteins that are inflammatory from senescent cells, or we are dealing with something like rheumatoid arthritis, IBS or Crohn's, something else that's inflammatory. It's important that we address these underlying conditions in the grand scheme of working with patients, because we need to help the human, the body, to actually better heal when we come in with a regenerative injection therapy. Now, if we have a patient who they don't really have a specific incident that began their injury, so they have low back pain, but there was never really an incident that contributed to the start or the drastic increase in that low back pain, then we place so much more effort on okay, let's get the human healthier. Let's work on nutrition, movement and exercise, sleep, hydration, social connections, all that type of stuff, and work on the underlying disease process, whether that's rheumatoid arthritis, IBS, low hormones, hypothyroid, whatever it is on that front, because it's likely that those are the things contributing to the inflammation, the brain's perception of pain, all these things that are causing the low back to be painful, whether or not it's a direct part of the disease process. Because again, some inflammatory conditions, you can have joint pain with it. Conversely, if we have a situation where someone has an underlying health conditions and they have a specific incident where they get injured, so they were lifting something, they were playing with their kid or their grandkid, and X happened, and maybe they had some pain before or they had no pain, but now they have more pain and that's what they're wanting help with. That's where we still want to spend time addressing the underlying contributors of health, nutrition, hydration, exercise, social connections, sleep, all that type of stuff. But that's when we feel more comfortable coming in with targeted therapies like prolotherapy, PRP, autologous stem cell therapy, perineural nerve hydrodissection, whatever that therapy is. That's a different conversation, but it's important for us to also address that piece, because we know that there was an injury that occurred that might have damaged something that resulted in this pain. Working on both is important, but it's understanding the history behind the pain that allows us to determine where we need to place weight in these buckets. So one, we can make an appropriate in-house referral to the right doctor who can help to manage that. But two, also that the patients are getting what we believe is a higher standard of care for their chronic pain.